Stroke Pe Rok initiative by Manipal Hospital doctors in Bangalore. Consultant Neuro Radiologist at Manipal Hospital on Old Airport Road, Dr Ullas Acharya. Consultant Radiologist Dr Abha Varma at Manipal Hospital, Whitefield, and Dr Abhishek from Neuro Surgery Department at Manipal Hospital at Old Airport Road spoke at length on various types of strokes that are prevalent and are rampant in an event titled Stroke Pe Rok. Team of Manipal Hospital doctors spoke on emergency medicine and are available in the same roof with facilities to handle critical care without a glitch by expertise manpower to offer extreme treatment with solid effort to cure the various types of strokes that were narrated by Dr Ullas and the type of radiological advancement features to examine and prevent anticipated strokes as a preventive measure. Early signs of stroke that can be easily detected with various symptoms narrated by Dr Abha Varma in detail. Stroke is a medical emergency that needs urgent measures to save a life. Early detection and identification having to understand a comprehensive stroke is a key factor. General anticipation is that speak about the strokes, normally we think it is a heart related, which is not the case. It could be various types of strokes that can occur in various parts, including brain, that needs immediate attention. Dr Ullas Acharya said that strokes can be prevented in 90% of the cases if it is detected early. He said, today the technology is available to detect early symptoms of stroke that can be prevented by way of Stroke Pe Rok.
A completely wrong concept. Stroke is treatable and it is one of the best treatment success rates. It is like even better than taking an antibiotic for your routine infections. You have a cold, you take antibiotic and we feel better. Such type of stroke treatments are far better than that type of a treatment. So the importance is when stroke we identify, earlier you come, earlier we diagnose, earlier we save. The better is the recovery, lesser is the disability, and death obviously will become a small chunk of those type of cases then.
Doctor, what is the quantum of success rate in these surgeries?
Yeah. So once we open, if we successfully open, it's a large vessel block. As we said, we talk about small strokes and large strokes. Small strokes do not need these type of specialized procedures, and they are treated with medicines itself, or maximum with those IV drugs which we talk about. If it is a large stroke, that's when the disability is high, and if you are able to open up the vessel, it is almost like 40% to 50% of these patients, we are able to get them to what they were initially. So that's quite a big number. When I say 40-50, it might look small, but no, in medical literature, 50% means 1 in every 2 patients which I treat, the patient probably can come back to normal life, and that is a very, very useful impact on his life, because as I said, he is fully free of disabilities then, and that itself is reducing, is back to normal in his family life as well. So that is the importance of having such emergency treatments.
What about
then? The only proven treatment is to rush them to hospital and open that. It is as simple as this: an artery or a pipe is blocked. Unless the pipe is open, blood flow is not going to happen. If you have a pipe being blocked at your home, the first thing which you would want to do is open that, remove those dirt which is there away, so that you don't have that rush of whatever other collecting materials which are there. So you would want to open that vessel first. So there is no other treatment, no other alternative treatment which will be effective in acute stroke. Mechanical thrombectomy in large vessel strokes, acute stroke, is the way to go.
Doctor, is Manipal Hospital conducting?
And how we do that is, see, one of these is also a type of that type of a program. We have called the press meet to have information shared. So basically you have to share all these things, like how to diagnose, and more the public is aware of such things, we try to mitigate. For the cardiac thing, you could see certain, in the traffic signals, there are signs of heart which is being placed. And that is to say that, so that whoever sees that recognizes, and there are scanners which are there close by. If you scan by, you will know the nearby hospitals and those kind of stuff. So that is you're trying to make awareness being there, trying to show in that terms, and you could also probably have in terms of so metro are there here, and you probably posters on in the metro. The government has to obviously have collaboration with us, or the hospitals for that matter, and you could do it in multiple ways. You could do it in Rotary clubs. You could have talks being given. So those are few of the things which we also do as this type of procedures. Probably cinemas are other things where people go and you have those advertisements. We probably would have seen for the smoking, tobacco, all of those things. Similarly, putting in a stroke video could be one of those awareness creating programs. So there are various methods by which you could do. It just needs the hospital administrators to come in and pitch in and create a project where public awareness will be made available.
To identify that there is a patient who has stroke, it is important to rush that patient to a stroke-ready hospital. Now, what is a stroke-ready hospital? It is a one which is equipped 24/7, 365 days with all specialities including neurologist, neurosurgeon, neuro radiologist and intervention. Plus, you should have CT and MRI under the same roof. Now, every hospital has a different imaging based protocol. There may be some hospitals which are they rely on CT, wherein you detect the early signs of stroke, or your hospital may be an MRI based, where an MRI is done to detect the early signs of stroke. Apart from that, there is a study of the blood vessels which is done to identify which blood vessel has blocked. So if it is a small blood vessel and if the patient is within the golden window period, then a clot busting medicine will be given. So most of the patients who have small stroke, they do very well with the clot busting medicine. But if your study detects that there is a major blood vessel which is blocked, then this medicine is not sufficient, and we may have to do what is called as mechanical thrombectomy, wherein we go from the groin or from the arm and we enter inside to retrieve the blood clot.
In terms of comprehensive stroke center becomes very important for us, where you have those facilities and time is not wasted. So for example, if you go get an imaging done in diagnostic center and then has to be transferred to a hospital in cities like Bangalore, where traffic is always a problem. The importance of such things needs to be again ascertained that we need to have a comprehensive. The patient has to go directly to the comprehensive stroke setup where all of these facilities are available. And what do we do if we detect a large vessel occlusion? As I said, these procedures are called like the angioplasties and stenting which you have heard for the heart. Similarly, these procedures are done for the brain. Basically, it's a blocked pipe. In simple words, we use special materials or catheters or stents to remove those clots from the blood vessels. The main idea here is to help the remainder of the brain. So normally, when the artery gets blocked, it might be supplying say 100% of that area. One road is blocked, which is leading to 100% of the area. As the patient comes, say there is only 10% of which is damaged. So we have some 90% of the brain yet for us to save there by opening the clot. So what the emergency procedure which we do is like a plumbing job where we go and remove those clots from these arteries using specialized materials, which could be stents, which could be catheters, and the procedure which is called as the mechanical thrombectomy. And as I said, this is done as fast as possible so that we save more amount of brain, so that the recovery is faster and the damage to the brain and the disability which occurs because of that is limited. Once this procedure is done, there is rehabilitation which takes place. The patient now has to come back to his normal life, which basically will include right from beginning. He has to relearn what he has learned in the past. That could be in terms of weakness which he has had produced because of the stroke, that has to improve by doing physiotherapy. It could be the vocational rehabilitation where you're able to stand. As I said, we saw in the BFAST, there is a balance. those things become important. So just to have a balance, to have cognition, to have proper emotional, to have proper thinking capabilities, all of these needs rehabilitative measures, and that's where the rehabilitation becomes important. Even to swallow, once you have might have had stroke and you might the patient may not be able to eat quite well, and to establish all those things also require a lot of time. So this rehabilitation program also becomes quite important. There are a few subset of these people who may have large stroke, and because of that may end up requiring emergency life-saving surgical procedures, which we call as decompression craniectomy. Maybe Dr. Abhishek can just inform a few words about decompression craniectomy in such patients.
Good afternoon, I'm Dr. Abhishek. So when we hear stroke, it can be presented. We see stroke in mainly two types. One is hemorrhagic and other one is ischemic. Hemorrhagic means there is a blood vessel that has opened up and there is bleeding within the brain. Ischemic means the blood supply to the brain is obstructed because of various because of a thrombus, like a blood clot that has blocked the supply to the that part of the brain. So these are the mainly two types of strokes that are presented in emergency. So coming to the causes of hemorrhagic stroke, hemorrhagic stroke is more commonly seen than ischemic strokes. In hemorrhagic stroke, what we commonly see the causes are due to increased blood pressure, that is hypertension. Due to increased blood pressure, the blood vessels may open up and blood may flow into the brain, causing hemorrhage. That is bleeding. So there are multiple other various causes also, like an aneurysm, where the part of the blood vessel is ballooned up and it may open up anytime. And there are other causes, other vascular malformations, as in disorders in the formation of blood vessels, like arteriovenous malformation and various other causes are there. Some causes may also be due to the inherent defects of blood, as in some bleeding disorders might be there, that also can cause bleeding, or patient might be on some medications like blood thinners that may cause bleeding, or he may have some defects of liver, so which can precipitate bleeding. And coming to the ischemic stroke, so in ischemic stroke, the blood there is a blood clot that has blocked the blood supply into the brain. So the blood clot may come from some, usually it comes from the heart, where due to the weakness of the heart, clots may form within it, and when blood is pumped, that clot may go into the brain and part of it may get blocked. So the blood supply to the brain is blocked, and that part of the brain which does not receive blood supply, if not treated, will not survive.
Next, I would like